We are Chiron. My name is Ruhan and my teammates are Amanrai, Suyash, and Amrita. What I'm about to tell you is a true, but sadly not uncommon story. A 40-year-old man in an orange jumpsuit waits shackled, alone, in the cold, sterile operating room like this one. He knows he's a diabetic, but how could he have known the small blister on his foot should have been evaluated sooner? As he listens to the risks of the surgery, all he can think about is life without his right foot. The tragedy is that a lack of understanding of his disease ultimately led to this outcome. Despite the talented medical professionals' dedication to their patients, the prisoners' lack of health education, combined with their low literacy levels, often leads to poor understanding of how to manage their chronic condition. Further than 40% of inmates have. Prisons spend an average of approximately $8 billion per year on healthcare. Disease progression is a financial problem, not only for the overburdened prison healthcare system, but also for the general healthcare system when the incarcerated are later released.
There is a compelling need for Chiron, a targeted, adjustable, and protected information hub that will decrease prison healthcare costs, achieve better health outcomes, and educate prisoners on their chronic conditions to set them on a healthier life path. Chiron will focus on the chronic diseases most prevalent in the prison population, as well as the general health section. Because prisons suffer from outbreaks such as COVID, there is a health alert section, and since paper can easily be lost, Chiron utilizes a one-way document access hub called Library. A key feature is the user's choice of 3 literacy levels, 2nd, 4th, and 6th grade to max their understanding. Interaction with the app can translate into rewards points. An inmate can learn about a condition's causes, effects, and related anatomy through videos, articles, and quizzes tailored to their literacy level. Chiron also offers a section on nutrition and diet, exercise, know your meds, and healthy choices with details tailored to the management of each disease.
In 2020, there were approximately 1.3 million inmates across our nation, representing a sizable TAM. Correctional healthcare in the U.S. is either run by states or by private healthcare companies. Our SAM is the 780,000 inmates administered by these companies, including Centurion Managed Care, which manages prison healthcare in 8 states. Centurion covers 4 prisons in Delaware, which represents our SOM. Although companies such as UpToDate and WebMD provide health education, no company specifically targets the unique situation in prisons. Chiron provides adjustable reading levels to meet inmates' needs. Further, existing med websites run on the open internet and do not comply with prison media access protocols. We are seeking $75,000 from the EDGE grant, which targets for-profit small STEM businesses in Delaware. The match will be covered with funds from Bay Health Foundation and Highmark, with whom we have preliminary contacts.
We estimate an initial startup cost of around $70,000. This includes line items of app development and content creation. As we expand beyond the first year, content, marketing, and training costs will continue to be incurred, and in year 3, there will be an increase in data storage fees corresponding to the increased users. In the first year, our users will approximate the 2,500 inmates in Delaware's Vaughn Correctional Facility served by Centurion. By the 3rd year, we plan to fully capture the inmate population in Delaware and start to penetrate our SAM. Looking at the graph where the expenses are in yellow and the revenue is in orange, you can see that in year 3, our projected revenue begins to far outpace expenses. A full pro forma can be made available to the judges.
Chiron is designed to be scalable. It will be used on tablet technology, which inmates already have access to. Chiron's open architecture makes adding more content simple. It is adaptable to each prison's budget because of the subscription structure that is based on the number of inmates. Lastly, marketing to private correctional healthcare companies means that our SAM is accessible through relatively few contracts. As you can see from the testimonials of correctional care professionals, Chiron will become an essential tool in the prison healthcare system. We have a well-qualified advisory board from various fields. We also have a relationship with a former inmate who will give us advice as an end user.
Our team has already had a busy 2020 to kick off Chiron. Early this year, we plan to secure funding and start app development and content creation. Testing and rollout will follow in late 2021. Next year, we will expand into our SOM.
Team Chiron is made of 3 freshmen and a sophomore across several high schools. We are inspired to use our knowledge of digital education to develop a platform for a neglected population. We feel we have the skill set, connections, and ambition to give Chiron Life Beyond Diamond Challenge and turn the key for the future of prisoner healthcare.
Thank you.
For listening.
No, right.
Thank you.